Hi, welcome back. Hamish Taylor here again. Welcome into what I think is an incredibly important video. But of course, I think all my videos are important, otherwise I wouldn't put the effort and the time in to produce them. But this is important because it is foundational to you integrating the knowledge that you can gain for your health from the results that you might get from your GP or your functional medicine practitioner. And it's all about the difference between the normal ranges that you will have seen on your bloods and the natural or optimum range and optimum levels that you want to actually achieve. But of course, first of all, because of the health environment we work in, here is a disclaimer. None of this is personal health advice, and you can read that at your leisure at some point. Right, moving on. This cartoon that I'm going to pull up now is absolutely brilliant. It is so simple. It is a single non-animated pane explaining exactly what I want to talk about. And this poor woman slumped on the floor is obviously representing her, not a lot of energy, not feeling great, but it could be your hormones, it could be your mental health, it could be your digestive ability, it could be your immune system, it could be just your get up and go has gone. And yet no one is taking this seriously, no one is telling you that actually there are some things wrong. So why is there this huge difference between the normal ranges that we have in our bloods and the optimum ranges that we're often looking for as clinicians in this field? Well, it's actually not that complicated. The normal range is based on a cohort of individuals, through no fault of their own necessarily, aren't very well. They are likely to be in hospital, more people in hospital to get their bloods taken than the people outside there. Also people who are old, infirm and injured. You get your bloods taken and those are all fed into the normal range algorithm. And over the course of my career, I have seen these normal ranges expand, shift, and what will surprise probably no one, actually go, gosh, men and women are different. And only last year we received a different normal range category for men and women based on, believe it or believe it not, muscle mass. Well, it struck me as a little observation that I've made over many years in clinic that most men are stronger and have larger muscles than most women. So to have a marker that's generic across both is just nonsensical. So it's great, we've got some changes, but we think we're up to date and modern, and really we're still doing a lot of catch up. So this normal range phenomenon is important, and it can be understood for most of the normal blood markers that you would get from your GP. And even sometimes when they aren't in the normal range and they are just outside and they're sitting in the pathological range, your GP might have written satisfactory or no action needed or normal for the patient. If they're sitting here or here, then they're out of range for a reason, and they need to be understood why that is the case. So getting your bloods from your GP should not be a problem at all, although lots of people think that it is. Ask them. They're not allowed to refuse your request. They are yours after all. And I often say that if your GP or the secretaries put up any kind of resistance and usually ask, why do you want them? You put your slightly incredulous voice on and go, because they're mine, please. And that is perfectly okay. Get your blood results to a functional medicine practitioner and see if there are any big differences between the normal and the optimum ranges for you. And obviously that is going to be specific to you. That is the whole point of personalised care, which is the way medicine is going, and not soon enough in my opinion. So it's quite normal to recognise and think that the optimum range would be in the middle of this. And that's not always wrong. It just depends on what that individual marker is. And a lot of these markers are Goldilocks markers, as we would describe, which is a reference to an old British fairy tale. But we don't want them too low. We don't want them too high. We want them somewhere sitting nice in the middle. But some of the key markers are massively skewed by the population that has their bloods done. And a perfect example of that is magnesium. Magnesium is the absolute poster child for recognising this. In the UK, the normal range goes all the way down to 0.6. But actually what we want is we want this range, the optimum range, to be somewhere, and that stands for optimum, but somewhere above 0.97. That would be great. But the normal range only goes up to 1.02, sometimes slightly depending on the lab. And that's another thing. Each different laboratory is likely to have a different cohort of patients, and even different regions of the country have different normal ranges. So watch out for that if you're moving about the country And yeah, make sure that you are getting familiar with these things, because this is lifespan advice, and this can be passed on to helping care for an elderly relative or a child who's not very well. A bit of a note on children's normal ranges. They are notoriously challenging, because a 15-year-old is not a 15-year-old the same as another 15-year-old, because they are vastly different in their developmental ranges. But also, just because a child has reached 18, suddenly they're expected to have all these normal adult ranges. And again, that's where the clinician and the individual appointment is so important. But going back to the normal range here, don't underestimate how important this is to get it right. And very often the GPs, understandably so, are only interested if it's outside of the ranges, because that then denotes some pathology. But very often we are still seeing these satisfactory or normal for the patient commentaries on the blood outcomes. So I hope that serves as a brief introduction to why getting your blood chemistry right is so important. I've just used one example here of magnesium, but it can be for your kidney markers, it could be for your liver markers, and it could be for the formed elements in your blood, like your red blood cells, your white blood cells, your platelets. It could be for your cholesterol levels, and that's a whole nother topic, and we'll put some links below about where to go with that. And it could be with your blood sugar levels. That's another conversation around your HbA1c. Just because it's below 42, people think, oh, fine, I'm great. But actually, we need to do a bit better than that. And that's because a vast majority of the population, unfortunately, have their levels hugely skewed towards the high side. And if things are skewed towards the high side, the GPs often don't recognise when it's too low, because often it's just considered low is better, because most people are on the high side with some of these markers that, like HbA1c as a good example. So as I say, I hope that serves as a useful pointer, a useful reminder, a useful investigative starting point to see what your ranges are, particularly if you are not feeling great, but you've been told that, oh, well, there's nothing we can do because everything's in the normal range. Well, get hold of your bloods, don't get hold of a commentary of your bloods, get the actual markers, the actual numbers, that's what we want to see, and get them in front of a competent clinician and see what we can drive forward. There'll be more following on from this, because obviously what do we do with those markers is very important. What do we understand them? The context in which we understand them is obviously very important. And again, these things need to be taken not as individual units or individual markers, but understood as part of a much wider, interrelated, web-like connective whole. And that can make a huge difference, particularly around something like magnesium, vitamin D, calcium, phosphate. These sorts of markers have a huge role to play in understanding possibly how your stomach acid is, and suddenly it gets really complicated. Beyond the scope of this video, as I say, hope that's been useful, and we'll see you next time. Bye for now.